And welcome back to the Morning Blend. And today we are continuing our series called Mental Health Moments, brought to you by Rogers Memorial Hospital. And today we're going to focus on a newer form of therapy that could help all of us be more mentally healthy. It is designed to teach us how to be more mindful, tolerate stress better, and regulate our emotions.
Sue McKenzie is the co-director of Rogers in Health, and she also works with the program to reduce the stigma of mental illness. And then Dr. Jody Pahlavan is from the West Allis campus of Rogers Hospital Memorial Hospital. And Dr. Jody is going to tell us a little bit about Dialectical Behavioral Therapy, or DBT is what we'll be calling it during the interview as well. So thanks for being here, you guys.
Thank you. Glad to be here.
This is great. So this is a newer form of therapy, this DBT. And talk a little bit about what it is and who it's meant to help. We've kind of given a little overview of who it's supposed to be for, including maybe all people.
Certainly. DBT is a newer version of CBT, which we hear a lot of currently in treatment. And
CBT is cognitive behavioral therapy.
So this is a version of cognitive behavioral therapy which has added some additional concepts to it. Originally this was designed to help the individuals with the most complicated, most severe forms of illness, which were causing suicidal behavior, self-injurious behavior. But in the recent years, in the research, as we've done a lot, as we've moved towards evidence-based treatment, we've realized it's helpful for more than that in those individuals. It's helpful with eating disorders. It's helpful with substance abuse. It's helpful in treating depression. And so it's a rather complicated treatment, and so it was a little bit difficult sometimes for people to integrate this into their system. It requires a lot of training. However, we've been really fortunate to do quite a bit of training at our facility, and we're able to offer this now, which is wonderful. So,
I've tried explaining cognitive behavioral therapy before to people, and it's difficult to explain even like from a layman's perspective, let alone having a doctor try to explain it. But what is it? Is it sort of like retraining your mind, or how do you explain it in a simple way that people can understand it?
Well, and it's really that connection between our thoughts, our feelings, and our behavior, and how those interact. So how our thoughts are really resulting in our behaviors. And so if we can correct our thoughts, we can then have impact on how it changes our behavior, ultimately. So with DBT, we implement skills. So it's a skills training program, and there are 4 basic skills that we use. The first is mindfulness, which is the core concept, helping us to stay present in the moment so that we're not reacting to a situation with events that have happened in the past, causing us to perhaps be judgmental, overreactive, but being able to stay focused just on this moment. And then we have distress tolerance. Life presents us with distress, you know, on a regular basis.
We know that.
Exactly. But if we're able to stay calm, not become judgmental, not react with, oh, 2 years ago when that happened, it resulted in this terrible thing, but to stay focused now and just ride the distress through, we tend to then be able to manage it and not become overreactive. And then with the next skill is
I bet I have it here.
Emotional regulation. Excuse me.
Yeah.
Emotional regulation. So that's allowing us to change those moments, those emotions that we're not comfortable with. The skills that help us to be able to change and not have this experience as frequently. And then lastly is our interpersonal effectiveness, relationships. Our entire life revolves around relationships, and we need to have strong skills, relationship skills, to be effective and to have a successful life. We found in the research that not only are these skills great in helping individuals who are having difficulties, but also we're finding it's great in prevention. And we know in medicine and mental health, prevention is the key. And we need to be proactive versus reactive. And we're finding that these skills, of the DBT skills, are really effective in helping our children. They're being implemented in the school system to help them become equipped to manage these issues so they can prevent incidents of the mental health issues that can arise.
It seems like some of these skill sets, which truly can seem to benefit anyone, almost promote resilience. You know, the ability to let things bounce off you and continue to move forward in a positive way. How have you seen patients react, and how's it benefited people?
Say, on the drive-in today, I was thinking, we often say to ourselves, if I knew then what I know now.
Yeah, right.
But I think in some ways what we're realizing is we can teach what we know now as mature adults to young children. And that's really, to me, what DBT looks like in the schools. It's, you know, we all face distress in schools. That's pretty typical. But we can actually teach people to recognize this is a stressful moment and there's things I can do about it. And so if we can start that young, the impact that that can have, and I think at least I'm seeing as schools are applying this, teachers being really surprised at what children are able to do. We used to say they had to mature to be able to do this, but they're actually able to do it at younger ages when we think about it as skills rather than something you have to learn by trial and error.
Or something that you have to take with medication. And Sue, you know, we've talked about this before. I'm shocked at how many young people, teenagers and younger, are using antidepressants, using anti-anxiety medication in therapy. I mean, these seem like a therapy and a skill set that would be great to bring into the school.
And we actually have, Growing Minds is just one of the organizations in our community that goes into schools and teaches mindfulness, and they're modeling it so that the teachers can learn how to teach mindfulness. I'm going to give you a very simple example. If I say to you all, it's time for the test, you could all probably recite the next 3 sentences. Put your books on the floor, take out the pencil, and your anxiety at whatever
goes up.
So instead, I say to teachers, if you say it every time, laminate it and stick it on the wall. You don't have to say it before every test. Instead, we're about to have a test. Let's practice our mindfulness. Centering our thoughts, preparing ourselves to be. And so what we're finding is these skills don't just make us cool humans, they really help us to do better academically. So teachers get it. When we work with teachers, they get that this is what's needed. Teachers aren't always graded on how well they're doing in terms of teaching those skills, and we probably ought to ask that question.
And I think those skills are as important as any. I want to ask you something real quick about Growing Minds in a second, but first, you can see stories of recovery at rogersinhealth.org. Really great to see stories of hope and healing because there is recovery and there is that hope. And you can also learn more about the wonderful care that is offered by Rogers Memorial Hospital by going to rogershospital.org. There are several campuses, including a new one in Brown Deer that you can visit, West Dallas as well, and Economowoc. And just very quickly, Growing Minds, is that something that schools or administrators can contact to find out about them visiting?
Yes. Okay. And I love their tagline. It's Calm Classrooms, Caring Schools.
Love that.
Just one great resource. And Rogers in Health, we can help people also with figuring out resources. We do some of that work too.
Awesome. Great to see both of you. Thank you so much.